Hi, my name's Christy and I'm here to talk about Lasik eye surgery. I just gotten it done in December. It is now April, so Filipino time is right on. I just wanted to go over the entire procedure of what I went through so that if you had any questions or comments or concerns regarding it before getting into it, hopefully this video will help answer and help ease any of your insecurities that you might have. So the first thing was research. I researched a couple different companies that were around my area, and I went with LA Sight here in LA. They were so informative, so sweet, so professional, everything about them. I highly recommend them. It was with Dr. Wallace. So I called them up for a consultation. So that's the first thing that you're gonna get is a consultation. It's free. They just wanna make sure that you're a right candidate for LASIK. I didn't know if I was going to be because my vision impairment is very minimal, so I didn't think that I would be a candidate, but I just wanted to see. My eyesight is negative 2.0 with a slight astigmatism on both eyes. So it wasn't horrible. It was just very difficult to see at night, but now that I've gotten it done, it's wonderful. I recommend getting it, especially if you're prone to getting headaches from eye strain. That's another... Anyway. So I went in for my consultation, and it's just like any normal eye exam. They examine your eyes, make sure what your vision is actually. They test the thickness of your corneal surface. They just look at everything at your eye to see if you're the right candidate. And if you are, then they go over the three options that they do. So the three procedures that they offer are PRK, Smile, and LASIK. PRK is not quite often used anymore, so that was something that they didn't really go over much, but I did a little more research after the fact just to see what it was all about. But it's photorefractive keratectomy, and basically what they do is they cut the top layer of your epithelium, which is your corneal surface. They take that out, and then they reshape the surface of your lens so that you can to correct your vision, and then it heals after 4 days because your tissues need to heal, like fully replenish itself and heal. So that was a little scary. Then there's Smile, which is small incision lenticular extraction. That one is basically a small incision that they make with a laser to your eye and reshape everything with only laser. There's no flap that's made, no top layer taken out. There's minimal damage, minimal dryness due to the fact that there's no corneal nerves that were damaged from the flap being open up and with the laser. And there's actually only a few centers in the USA that actually offer this procedure. LA Sight does offer it, so if you do not want a flap cut open, then they're one of the few centers here that actually offer that. And then there's LASIK, which is they take this contraption, they cut almost like 75% of a circle, and then lift the flap open, reshape the eye with the laser, and then close the flap back down, and then you're able to see. You just heal for that day, and then the next day you've got about 85% of your vision back, which is better than what you had prior, and then it slowly gets better and better over time. And I'm still doing follow-ups only because I'll talk more about it later, but it was just like dryness in my eyes, which is one of the side effects of getting LASIK, but I will go over that with you at the end of the video. So those are the three options. I went with LASIK. It costs about $13.75 per eye because I don't have horrible vision. My vision's negative 2.0, like I said. So it wasn't like a lot of reconstruction, so it was not that bad. I used also my flexible spending account, which helped with the cost because when I was putting that in, it's like tax-free, I don't know. But I used that, and then I think I only paid $150 out of pocket to cover for the rest of the cost. So that was that. So I did that on Monday, and then I had my surgery on Thursday and my follow-up on Friday, and I was good to go. So basically, if you are squeamish about your eyes being touched, then you probably don't want to watch this video. It's very Clockwork Orange. If you don't like your eyes being prodded open like that, then please, I'll timestamp it and you can skip ahead until after, and I can go over the follow-up and aftercare. So stay tuned because you'll be up close and personal with my eyeballs. All right, so that was a little gross, but aftercare. So I wanted to go over aftercare since it's been 4 months since I've gotten it done. The next day after the procedure, you don't want to drive home, so please make sure that you have someone that will pick you up, drop you off, or stay with you, because it's not a long procedure. It was 10 minutes. But a lot of it's waiting because it's like prepping to make sure that your body's relaxed, because they'll give you Valium and then to relax your body, and then they numb your eyes with these drops. And before we even began, I was so scared, and I said, like, they put the drops in and then they immediately like stuck me under the machine, and I was like, are you sure? Are you sure that my eyes are like numb? And they're like, do you feel that? And I was like, feel what? And they're like, we're already prodding your eye. And I was like, oh, okay. So I was good. That just scared me, because what if it wasn't? And they were... Okay, anyways, back to the subject. So make sure that you have someone to pick you up and take you home, because that day you're gonna be extremely loopy. You don't wanna, after you're getting it done, or after you've gotten it done, they'll give you drops, and you should pick up your prescription prior to, preferably, but it's an anti-inflammatory and an antibiotic for your eyeballs, and then TheraTears, which is, they prescribed me TheraTears, which is just artificial tears. Oh, there's something in the air. Which is artificial tears to help lubricate your eye. You might say like, oh, I've got eye drops at home. No, it has to be preservative-free, artificial tears. You do not want to put regular eye drops in your eyes because you don't want to mess up your eyeballs. So that's number one. Number two, don't watch TV, a movie, read a book, or on your phone after you get it done, because when you're on your phone or you're reading, your eyes go back and forth. And you don't want your eyes to go back and forth like this. You want your eyes to heal. You've just gotten a flap cut into your eyeball. And if you moving your eye around like that could disrupt the flap and hurt your eye, and that would be disastrous. And so then you'd have to go back and pay even more money to get that fixed. And I don't think you'd want to do that. I fell asleep only because I was so hopped up on Valium that I couldn't move my legs. So I just fell asleep. And the next day you go in for a follow-up and you should be fine. You should be able to drive safely to the doctor's by yourself. You don't even need anyone to take you. So I went in, they checked my eye just to make sure that everything was okay, and then they schedule you, if everything checks out, then they schedule you in for a 1 month follow-up. After 1 month, okay, let's backtrack. After the first week, those TheraTears, they were fine for my eye, but after that, it just got so dry, and so I had to switch to another form of eye drops, which was Bausch & Lomb's Soothe. They come in individuals, and as much as I enjoyed how much more lubricated it was, I didn't like the fact that they were individuals, and so it felt like it's just a waste of plastic, because you tear it off, snap the top off, and then drop it in your eyes, and then that's it. And then there's still like 10 more drops left, but you're not supposed to reuse it, and I just felt like that was a waste of plastic. But it helped my eyes for like 2 weeks, and then when I went in for my follow-up, they said that my eyes were still really, really dry, and so they gave me like a Sustain gel to drop in at nighttime. And so I did that, but the drops still were like really dry, and I'm not the best at remembering to put eye drops in, because I kind of just like power through to whatever I need to get done at work or whatever, and I'd always forget. So don't be like me. If put it in every 2-3 hours if you get really dry eyes. So then I switched over to Refresh Optive, which actually worked wonderfully. It was more lubricated than the other one, which the Refresh, and so that one worked. And also what I liked about that one was when you snapped, they were also individuals, when you snapped off the top, you could snap the top back on and it would like stay, so it wouldn't just fall off. So you could actually reuse it. You're not supposed to, but I'm cheap, so whatever. So I snap it off, drop it in my eyes, and that's like 8 drops instead of just 1, so I would save it. But then when I went back to the doctors for my 2-month follow-up, they said that it was still dry, and I was complaining about that too, and I was like, I didn't know what else to do, and so they actually took these small plugs. They're called punctal plugs. It's about the width and size of an eyelash. You pull your eye down, look at the opposite direction, and then they plug up these punctal plug things into your eyeball. And within 5 minutes, it made a world of a difference of moisturized eyes. Like my eyes were not even dry. I didn't even put any drops in yet, and they were just completely moisturized. And then they prescribed me, they gave me Sustain eye drops, and those helped. But when I came back, she said that there was just still a little bit of dryness here and here, because those plugs, they like disintegrate after 2 weeks. And so I came back 2 weeks later, and she said that your eyes are dry, but not as dry, so it's working. She's like, but now this time, just keep dropping your eyes every hour. And she's like, and then do these ointments at night. So I was like, okay. And this one was I forgot the name of it. I'll put I've got like 5 different eye drops. You could pick which one works best for you, but they're all preservative free, and they're all great for your eyes post LASIK surgery. So I'll post the links below for you. But actually the ones that were supposed to be used for nighttime, which are also individuals, but they snap on top too, so that worked out. It's basically like mineral oils. You're only supposed to put it on night because it can really blur your eyes, because it's much oilier than traditional artificial tears. But when I put that on my eyes, it didn't make anything blurry. It just like my eyes actually like absorbed it all and made it much better. It like cleared the dryness away immediately. So I actually really like this one. But anyways, yeah, they actually put in another punctal plug in my eyeball, the last follow-up. So I have another follow-up in 2 weeks, because they just want to make sure that my eyes are okay. And that's another thing about LA Sight, is they want to ensure that what they did is correct, and that I've been taken care of, and that my eyesight is perfect. Because they fixed my eyes, and they want to make sure that they fix my eyes, and I absolutely adore that fact that they are bending over backwards to make sure that my eyes are completely perfect before, that they send me off on my own way. But I love it. And they're always really sweet. They're always really nice, and they have a big picture of Iron Man on the wall, so I'm cool with that. But anyways, yeah. Okay, well, that's basically it. So if you have any questions or comments, you can ask them below. I'll try to answer to the best of my knowledge. Hopefully this video helped ease any concerns that you might have had, or answered any questions that you might have had regarding LASIK if you're considering it. I'm not sponsored by anyone, because this is my first video, so this is all pure of heart and hoping to help someone with their journey. Anyways, Thank you for watching, and I hope to see you soon if I make another video. Unless this one totally bombed, and then this will be the last video I'll ever make in my entire life.